welcome to everybody, wherever you are, whatever time of day or night or which day of the week it is. Please do say a cheery hello in the chat. It's really great to just get a sense of who's around and who's come to join us. And James and Dom are at that already, which is brilliant. But listen, we've got a really special session today, and just a really warm welcome and thank you to Lisa, to Victoria, to Helen, who work at an amazing organisation, which some of you will know a bit about, but they're going to tell you loads more about. And we've got a really amazing bit of time together, and then we're going to try something a bit different in the breakouts. We're going to get into big-ish breakouts with four groups, and then come back together to kick things around. So listen, without further ado, Lisa, I think I'm passing on to you.
You are, and it's really thrilling for us to be here. I just wanted to introduce myself. I'm Lisa Hollins. I'm the Executive Director of the British Red Cross, and my wonderful colleagues. We've got Victoria Corbishley, who's very kindly sharing the slides, and who's our Director of Health, and Helen O'Connor, who leads our community education in schools and communities across the UK. So we're going to talk about some of the work we do, just as an introduction for about 20 minutes, and then ask for your help in thinking through those links between activation and kindness. We know you've had phenomenal experience, and we'd love to hear more about that, but find connections in that work. And we're going to end with a video of one of our services built on kindness, that we wanted to share some views of the staff and service users. So we will do that right at the end, once we've heard very briefly back from all of the groups. So firstly, I just wanted to say I've joined the British Red Cross after a very long time, nearly 30 years in healthcare. And I found that I was becoming compelled to really think about how communities looked after each other, how they organised, and how we could support the humanitarian mission in wider society. And I think colleagues on the call will know there's many links between the humanitarian work in organisations like the British Red Cross and work in healthcare. So I felt I've been very well prepared in healthcare by dealing with some of the most difficult experiences and supporting people through those, the most difficult experiences that we can imagine. That's certainly what we do in the British Red Cross in the UK and abroad, and it's what colleagues do on the call with people in the NHS and healthcare around the world every day. So a lot that is similar. And I joined just after the pandemic, when we saw the huge inequality that people lived with, and it brought into stark reality what an impact and how unequal the same pandemic had on different groups in society. But it also brought with that the real power of communities to mobilise, and that's what we'd like to talk to you about. We've got Victoria will say a bit more about some of the services and the links between activation and kindness, and Helen will talk about our community work, and then we'll separate into groups. You'll have heard of our work in disasters around the world. So we work in all the big conflict zones. I won't mention all of them, but there's some that we hear in the news every day. And we work around some really compelling fundamental principles that we really hold dear in terms of our work. So people join us because of our humanitarian principles, our neutrality, our universality, that we work with everybody across the world, no matter what situation they're in. And in terms of the UK, we work with people who are in crisis. So we work with the biggest provider of refugee services, with people who have lost everything. We work really strongly with people in crisis. So if you hear of 100 camp beds in a community centre in Penrith who's flooded, and people providing emergency food and shelter, that's usually the British Red Cross. And we're so proud of our work with our fantastic colleagues in the NHS in healthcare. We've got 150 contracts. I'm going to pause there and hand over to Victoria, who will say a little bit more about that work.
Oh, thanks, Lisa. I thought I'd start off with a little bit of a story to showcase our work in action. So this is the story of Mr. P, who is living with COPD. And we came across him through a referral from a virtual wards team because they were worried Mr. P was struggling to get his blood pressure readings across. And they asked us to go and help get those readings collected and see what we could do to increase his confidence with the technology. So we went along and spent some time with him, and we did exactly what we were asked to do. We looked a little bit about the equipment, tried to get to the bottom of why the readings weren't being collected, and discovered it was an incorrect Wi-Fi password. So we were able to establish that connection. Now, technically, that's where we should have ended, right? That's what we were asked to do. That's what we did. But then we started talking, and we found out that he'd lost his wife just a year before, and he was experiencing loneliness. The phrase he used was he'd all but given up. And so what we wanted to do was not leave him there in that position, but to help him reconnect with people. And we did that in a couple of different areas. One, the COPD local support group was there. So we wanted to see if that was something that would be of interest. It was. So we managed to get a referral into the local COPD group. And the next thing was looking at some practical ways we could help. So he needed a bit of shopping doing, he needed a bit of cleaning doing. And then he started opening up a little bit more, mentioned how he was struggling getting the bins out. So we managed to connect him into his neighbours, who that connection hadn't been there before, but his neighbours were really keen to help. So they started offering to put the bins at the top of the road for him. The reason I share this is not because it's a dramatic story of how a kind word saved a life, but in many ways it did save a life, because it made sure that Mr. P absolutely had the clinical care because the readings were there, but we went above and beyond and tried to make sure that we didn't leave him without that sense of connection. And this is because the power of kindness really drives everything that we do. And the starting hypothesis for us is really, can kindness increase health activation? So in our service we absolutely capture health activation. We use the CHAI methodology. And these are the steps that we sort of take. One is, we think kindness helps us with our workplace. It helps teams support each other. And we think it's more likely to retain our teams. We try our hardest to recruit for softer skills and train the technical harder stuff, but actually it's the softer stuff that is the harder stuff. We really think about how we measure tasks. So when we look at a contract, often we're incentivized to measure a task. How many people have you taken to a certain place? Where we're going is on outcomes. So we've just done a big piece of work moving from tasks and inputs into health outcomes. And our teams are incentivized on that outcome basis. I say incentivized, there's no financial incentive. It's a sense of pride, and it's a sense of community and purpose, really. And through this, we think we're seeing more activated people we support. So let's look at the figures. This is for one of our services. The outcomes that we're tracking show a 93% increase in activation, which we're really proud of. Yes, service users and families say the service is extremely good. We think people are leaving our support more confident and are better able to look after their health. And in doing those things, it also has an impact on demand for emergency services. We're seeing a reduction in ED attendances for this particular high intensity use group, and we're seeing a reduction in ambulance conveyances. So we think our hypothesis works, that kindness helps for activation, but in the groups later, I'd really appreciate any insight and evidence that you've got to help us prove that link more. And in case you weren't aware, this is the breadth of services that we do offer. So it is everything from patient transport, social prescribing, high intensity use, and home from hospital work. And with that, I'm going to pass on to Helen.
Thanks very much, Victoria. Hi, I'm Helen O'Connor. I'm Head of Community Education, and I want to share with you some of our thoughts around the role of kindness in building community resilience. Our work at the moment in community education is more around discovery work. We're doing some research into how we can work more effectively to build community resilience. I'll start by telling you a little bit more about community education. So the Community Education Service basically has a team of people who deliver education out in communities, and the team's about 30 strong, and they have around 60 volunteers who work alongside them out and about in communities, delivering sessions such as everyday first aid, helping people to understand how they can build empathy in communities in relation to migration and displacement, how they can cope better with challenges, and how they can support connections. However, most of our work is with young people in schools. So last year we educated around 135,000 learners in workshops up and down the UK and in England, Scotland, Ireland and Wales, and yet most of those workshops were everyday first aid, and then around 25% of what we do is in relation to the other topics, so empathy, coping with challenges and supporting connections. And we have a plethora of other forms of education on the British Red Cross website that relate to humanitarian education, such as international humanitarian law, how to talk to children about conflict, and helping teachers mostly to understand how to talk about difficult topics. But what we're doing at the moment is doing some discovery work about how we can broaden our impact, still working with schools and youth workers through the development of a humanitarian education programme, whereby we're trying to get the teachers and the youth workers to deliver our resources for themselves rather than us deliver it directly to their pupils. And one of the reasons we want to do that is to enable the teachers to deliver the education, because we think it will have more impact because they know those pupils better than we do, and because we think it will increase social capital in the community if the teachers who know the community deliver that education. But also we think it will give us more capacity to deliver out in the wider community, where we want to build more resilience, because we're facing an external world where there is far more crises or interconnected crises. So we were talking about the weather earlier, and often now in our team we're talking about flooding, and on a day-to-day basis you can read in the news stories in England about certain communities that are affected by flooding and being flooded repeatedly, and this in turn is causing trauma to people in those communities. And we want to explore ways in which we can therefore bring our humanitarian work to communities to help them prepare better when those crises happen, not as individuals, but as whole communities. So that's why we're interested in what the role of kindness is in those communities. And from a more kind of academic, perhaps philosophical point of view, I've been thinking about the ancient African concept of Ubuntu, which I'm sure some of you may be more familiar than me. Even I come from a theology background, so it's the sort of thing I tend to show a bit of interest in. And the concept is around I am what I am because of who we all are. So I can flourish if you're flourishing. And the concept of kindness seems to speak to that sense of empathy and thinking about the other in community. And yet we might argue that there's more individualism in communities. People are more thinking about self-protection and so on. So We want to try and develop education that would help communities prepare together and be more connected. So I've constructed this little hypothesis. Reading it again, I'm thinking it's a bit of a no-brainer, but kind communities are more resilient in a crisis. When people in communities enact the value of kindness, it leads to positive social connections being made, and strong social connections lead to a sense of belonging within the community. And therefore, connected communities with a strong sense of belonging, which are characterised by kindness, are more resilient in a crisis. It would be really lovely to share with you some time in the breakout group to see what you think about this hypothesis, and whether you've got any insights into how we might build our education to help people in communities prepare more for the things that might affect them. We've also been thinking about hope and interrelated values. So if you've got any thoughts on the values that are interrelated to kindness. So we've been particularly thinking about hope. We were looking at Paulo Freire's pedagogy of hope. And, you know, if you're too fatalistic about things and you don't have hope, then, you know, you're not going to be able to take action. So we want to think about how we can utilize kindness as an active, a value that is enacted in relation perhaps to other values such as hope, that will galvanize people into taking action together to build the resilience in their communities in a humanitarian way. So that's my starter for 10. And the question is there ready for the discussion group. What is the role of kindness in building community resilience in relation to coping with crisis?
Wonderful, thank you, Helen and Victoria. So we're ready to go into groups, and Bob will help us go into 4 groups, and Helen and myself will facilitate the groups on community and kindness, and Victoria and James Malford will facilitate the groups on individuals and kindness.
Lisa, Helen, Victoria, that was absolutely fantastic, totally amazing. I'm sort of somewhat spellbound as I sat listening. I think in the background I've managed to get people organised into groups. It'll be about 13, 14 people in each one. If you find you can't get into a group, or you have some total IT disaster, just log off, as in sign out of the meeting, and join the meeting back again. You'll come and meet me in the middle, and I will try and allocate you to somewhere. Remember, we get this sort of 10-15 second, maybe minute bit in the ether where you sort of get lost on things. So sit tight while Teams does its thing. I'll send you all across now. Lisa, what sort of time do you want? 20 minutes in, do you think, in the group?
20 minutes is perfect.
Okay. Yeah. Cool, perfect. Well, listen, let's go for it. Have fun, everybody. And I'm hoping I've vaguely done a good job. Let's see what happens with the breakouts. But if you get lost, or you're worried about something, or the IT blows up, come and find me again by signing in the meeting. Okay, let's go. Listen, welcome back. And I think probably handing over to you guys as facilitators to just talk through a little bit about what you were up to. I've got proper curiosity to learn about it. I suspect everyone has. So back, yeah, over to you, Lisa.
Wonderful. So I will just for a couple of minutes just to talk about some of the, again, very profound thoughts that people had, but also connections we'd started to make in our groups. So we talked about the building resilience and really supporting people before crises struck, and the links with health professionals training. So we would love to host health professionals, or link with health professional trainings. If there's any way, I'm sure people on this call will figure out a way, if it's possible, to do that with some of the fantastic materials that we have. We'd love to do that. We talked about the link with integrated care and actually knowing your community, and had a fantastic example of a community walk to get to know your community. But as we move much more towards integrated care, of course those community links are going to be very important. And then we also talked about the strength of community in disasters and how we recruited with kindness and compassion, and we've been doing some slightly different recruitment around some key questions rather than a standard application form, which I promised to share. Just wanted to end on a fantastic comment from a colleague who said we should celebrate every positive step to build hope. That was from Marvick, and thank you so much for that comment. And I think I'm going to hand over to Helen.
Okay, great, thank you. Just want to say thank you to my group. I didn't get a chance to say goodbye because I had to fasten my seatbelt, but it was a great group to be part of and really interesting discussion. We started off by talking about Margaret Wheatcroft's book Restoring Sanity, which had been mentioned in the chat, and then we got on to talking about awakening values as intrinsic human capabilities, which I found really interesting. And we talked around them being habituated in our ways of living and being able to recognize them because they become habits. We talked a little bit around sort of interrelated concepts such as joy and how we use different words to mean maybe similar things, and that we need to be curious about finding out what ways we use to express what we mean by things that are related to kindness. I think that's what we were saying. We also talked about what detracts from kindness, and we talked about the relationship between kindness and resilience is a bit of a chicken and an egg situation, because you know, what comes first? You need to be resilient to be kind, you need to be kind to be resilient. We talked about kindness at scale and how it's not just about being nice to people, but it could be seen as being challenging, disruptive, bold, radical, and yeah, those kind of things we talked about in relation a little bit to the Red Cross fundamental principles and how hard it is to be radical and bold and disruptive at the same time as being neutral and impartial. And we talked about everyday kindness, such as active listening. So not just sort of big grand at scale things, but actual sort of day-to-day things, everyday things that you can do yourself to model kindness, which might get picked up and spread around because you've been practicing it in a community or a group or with a group of people, and that we don't call out often enough the behaviours we want to see, such as active listening. We tend to focus on the negative a bit too much. And we were just about to talk about peer learning, because I said, you know, can we teach these habits to young people to build the next generation of humanitarians? And the answer to that is yes. And we were just going to talk about peer learning, but we got cut off and fastened our seatbelts and came back to this group. So there we go. That was the kind of thing. If anybody wants to, you know, put in anything that I missed out or misinterpreted, then please do.
Fabulous. And of course we've always got the chat as well that we can add to. Victoria, we're going to come to you next and then to James.
Well, thank you. Well, I had a great group, and we were having a really interesting debate about trust and confidence, and about how they were both really key for health activation. But in order to get trust, the importance of time and how to think about time and how that helps in terms of building trust. So the debate was very much about, okay, is it the length of time you spend with someone? Is it the number of touch points that you spend with someone? What's more important? And how do we build up that sort of relationship where there is that trust between health professional and patient, or family members, or any service provider? And we also spoke about how you don't just need to activate patients, you also need to activate the team of people supporting them as well. And it was really important to do both. And then we heard from Mo, who gave us a great tagline for our session, which is, even constipation can be sexy. The point here was she'd spent time listening to an individual about what mattered most to them. That was the question. And so through that question, that trust and rapport was built up, so that somebody who was struggling with constipation was actually becoming really engaged in it, and had gone away and had got all sorts of information and t-shirts about the Bristol stool chart. So that's our takeaway. Think about time, think about how we build that trust and confidence, and even constipation can be sexy.
Wonderful, Victoria. That really important role of listening. James, we're going to come to you, and then we're going to end with a video.
It's quite hard to follow that. I mean, Bristol, it's so exciting. So thanks to everyone in our group. Let me try and pull out a couple of additional themes, I suppose. So we had a clear sense that it is sometimes in the moments of greatest adversity that communities seem to pull together. And there were examples, several of us were from London, and there was an example of Grenfell Tower, which was this horrendous fire in which over 70 people died in a tower block about 6 years ago, and also COVID. But then there was a wonderful example from the recent eclipse, which isn't a disastrous event. We now know that the sun will reappear. But what we heard was that in Indianapolis, people were exchanging, greetings and phone numbers and emails in a way that wasn't normal. So what is it about those unusual moments, and how could you play those through to the day-to-day, particularly in London, which is notoriously unfriendly and nobody knows their neighbours? I jest, but only partially. And then, and I'm going to be a bit sharp from maybe a stereotype of Brits and our willingness or not to talk about religion, but we were talking about back to the story of the gentleman at the start, Mr. P, and how you didn't talk about the team, Victoria, but we suspect that the team grew and benefited from what they did, and that there's a sort of in giving you receive, being a feature of kindness, a kind of alchemy we've previously said about it, which is also notably, I think, featured in every religion that I seem to have come across. And then I guess underneath all of this, I know that Paul Bertalden is in the room somewhere, and this notion of kind being related to kin, meaning a sense of family and community. And of course, that raises the question about where are the boundaries to my kin? So if this is my kin, then, is everyone in that? Is that everyone in the whole planet? Or am I going to draw a boundary somewhere? And what are the implications of that? So thank you, Room One. It was a marvellous discussion. And I also would say that I think we take the prize for the youngest participant, because Katie had 6-year-old Ivy with her, who's currently on the screen.
Fantastic. And Steve, we've got a question, but I'm just going to go straight to the video, and then I think we've got time for 1 or 2 questions afterwards. Thank you, colleagues.
So the project started when I went out in the ambulance service, and I was going out to the same people all the time, and everybody was angry. The paramedics were angry, thinking everybody's time wasting, the A&E was angry, and the people themselves were just, nothing was changing. And I thought, we've got to have a different conversation. A crisis can happen to anybody. It's just human beings. They need friends, they need purpose, their basic human needs being met. They need somebody to love them. People don't have that one person, and you're living your life on your own. And I thought that cannot be. We can't have that in society where you've got a group of people out there who are just fending for themselves and don't know how to reach out.
To be quite honest, I didn't know what I wanted to be. I hadn't really got a dream as such. I did well at school. I went to college with 3 A-levels. I could get to university, then decided not to. Perhaps that's a regret in life, that I didn't pursue it. I felt myself feeling down on a regular basis. Then I fell into, depression, partly deep depression. It just crept up on me. One day I just thought, sod it, I can't get out of bed. 3 or 4 days later, I'm still in the bedroom. Your mind in the situation, you just feel like it's just like mashed potato. One day merges into the next, and before you know it, it's a mess.
Sometimes in life, circumstances come together that mean you are vulnerable or you're struggling. These things are not black and white issues. These are things that are quite subtle, and you're talking about emotions and people's psychological well-being.
I find it very difficult to be proud of myself in any way. My father abused me from a young age, and I was at A&E quite regular. Some of it was overdosing, some of it was chest pain, but I think a lot of it was just that I had so much that I was dealing with.
I can work with somebody who's got numerous voluntary sector and statutory agencies working with them, but they're working in silos, and quite a lot of the positive outcomes I've had has been by being quite tenacious and fighting for the client, and by drawing it all together, kind of being that conduit, if you like, between the client and the hospital, making sure that the appropriate services are in place so that people get the right treatment from the right organisation.
You've got medical facilities that people can go to, and then you've got social care. But in the middle, there's this void. There's a no man's land here that's going on, and so people fall down that gap. If you can imagine, if you've gone to A&E 50 times, some people go twice a week, every week, all their lives. They are offered the same thing all the time, and it's not working. So we have to do something different. We've got to step outside of the very place we don't want people to go.
I mean, I started ringing the ambulance out of almost desperation, really. I just needed somebody there to talk to. But then when I've rung the ambulance and then I'm sat next to somebody in the A&E, dripping with blood, I've got somebody drunk next to me, and my anxiety levels are just going through the roof. That's definitely not a place where I should be, because they just simply aren't geared up to help.
People who are using our service are the people who need support and are not getting it from the statutory or voluntary services that are currently in place. There is often a gap, and HIU bridges that gap.
I think I needed to have spoken to somebody in length. Just a simple phone call and a visit to your house. It's more of a relaxed, calming thing than being in an A&E or talking to a nurse that's a bit abrupt. It was a random phone call that we met and spoke. I felt like a weight almost being lifted off my shoulders because I could actually talk to somebody that understands.
We make that initial phone call and we explain to them that, you know, we're worried about you and we just want to make sure that you are getting the best level of care. There's obviously something not right in that person's life. There's a reason why they keep presenting in A&E. They've either got no one to help them and support them, or they're just lost and they need a little bit of guidance. That's where we come in. You know, what is it that we're missing? And the best way to find that out is actually to sit down and have a conversation with that person. A real, genuine conversation.
It gives you clarity, it gives you support, there's lots of things that it gives you, you know. I could write a list a mile long.
Once somebody's helping them with their physical health or helping them manage a mental health problem, it gives them the opportunity to achieve all sorts of things in their lives.
When we understand the root causes, it puts us in a better position to be able to offer guidance and advice and support. It is different, it's unique, and it works.
To see somebody who, when you first meet them, hopeless and helpless and overwhelmed and just don't know where to turn, eventually, you know, you look at them and you think, you don't need me anymore, and that is just fantastic.
I can't believe how far I've come. I'm in control of my life. I don't need A&E. I'm safe. For the first time in my life, I actually feel safe.
Thank you so much. That was our high intensity user services, which Victoria mentioned in her presentation, and we thought we'd share some of the stories of the service users and staff.
Wow, Lisa, huge thanks to you and Helen and Victoria. Just a massive thank you and congratulations for everything you and your teams are doing. What an amazing organisation. So much rich work for us to learn from. Thank you. Thanks for your generosity tonight as well. Just been an absolutely brilliant hour. And huge thanks to everybody on the call. For these things only really work because everyone here comes and mucks in and chucks lots of ideas and things. And I know Victoria and Lisa and Helen will be giving some good thought and reflection to some of the things that they've heard in their work. As Susie says it, the hour flies by. 3 quick things to flag, really just stuff I put in the email. We've done some really sort of detailed work around, and really led by Nikki and Helena, and then the wonderful Kaleidoscope team on the website. So it's a very basic, rudimentary website, but it's so rich with amazing things. The monthly conversations are up there. It takes a couple of months to get us sort of up to speed on them, but the resources section's got loads of things. So some of you get in touch with me to say, can I use this or that to help me do some teaching? There's loads of great resources up there. There's slides and things like that. So please go and use that for anything you're doing. There was a little call, and particularly reaching out to anybody who's got a nursing background on the call. Tessa, who is a wonderful friend who was doing great work in helping run the International Forum last week, is doing an event in October, Nursing Live, which is a big sort of national UK nursing event, and is looking for a couple of people to come and help run a workshop on kindness and any angle of it. So that would be absolutely amazing. And then the final bit is to do a little a flyer for the wonderful Claire, who is, I have a feeling might have been on the call a little bit earlier, across in Canada, who I was lucky enough to meet for the first time in the UK last week. Claire is our magical guest next time round, May the 16th, if I've got my dates right in my head. And I think we'll have Nikki back in facilitation. So really excited about that. I've posted a link to Claire's website to have a little peep at if you want a trailer for that. Above all, thank you to everybody. Look after yourselves and have a great rest of morning, afternoon, evening, or whatever you're doing. And a final big shout out and thanks to Lisa, Victoria and Helen. That was absolutely magical. Really, really grateful. And keep up the good work. Keep in touch. Keep coming to these meetings and let us know how we can get involved. Take care, everybody. We will catch up soon.